feel so good, right? So I'm sure you've heard about the governor reducing budget by 10%, looking at another 10%. So this is a major focus for us at the Chamber as we move forward, how those cuts are made, what we are going to have to do to sustain our state. The way it looks right now, we might want to figure out ways to keep some of our money home and fund some of our projects. So we'll be working through that as we go forward, right? But that's going to be a big topic as we move forward. We'll be starting to meet with our newly elected officials in the state legislature in the next couple of weeks. And that's item number one, tax and cuts and how we're going to move forward, how we're going to pay our bills in this state. We did have an election this week. I'm sure everybody's about tired of it, but there's some exciting news there too, right? We have a new group of leaders that are coming in. We've got a couple with us today. So Brian Lovett, County Commissioner, I know you actually have been filling that spot for a while, but congratulations on your election or re-election and a half, maybe something. But anyway, Brian works with us a lot, so congratulations on that. We also have Patrick Collins with us, who is the mayor-elect of the city of Cheyenne. I'm very excited about this one. Patrick, he's one of you guys. He's one of the business people of Cheyenne. He supports the military, and that's certainly a good thing for us. About 2 years ago, we had to ride to Minot, North Dakota. So he's already used to putting up with me, so he'll expect calls from the chamber, right? But Patrick, certainly, just personally, you're my friend. Congratulations, and a job well done, and a nice campaign that you ran. So. With that, we got a few things coming up that everybody needs to know about. So we're going to have a Christmas parade here in about 3 weeks, and look forward to that, starting to get in floats. Hope you will be a part of that. Part of the way we fund that is through poinsettia sales. So, you know, it's a good opportunity if you're in trouble with your wife, or maybe your staff needs some flowers, whatever it might be. I'm not looking at anyone in particular on that, right? You can order those poinsettias. It's a great way to do something neat for somebody and also help raise a little money for the Christmas parade. Next month is our Women's Leadership Award that we give every December. So please take a little time, look around where you live, and look for women who deserve to be recognized for the work that they have done in our community, serving a leadership role to be mentors and leaders for other women in Cheyenne and Laramie County. We can't recognize them if you don't nominate them. So please, please do that. I hate to tell you, but the deadline is like this afternoon, I think. But it doesn't take that long to do. When you go back to the office, sit down at your computer, spend just a couple of minutes, call my staff. We'll get the ball rolling, and we can make sure that we have a nice group of those folks that need to be recognized. On Wednesday, November 18th, Java with Mary Jane. I know a lot of people have enjoyed that, talking to Mary Jane and learning more about the chamber and what we're doing. So Mary Jane, are you going to be there? She's talking. So yeah, no, Mary Jane says she will be there. So Java with Mary Jane. Mac Luncheon on Friday, November 13th. So for those of you that are already involved with Mac, I'm sure you'll be there. But for those of you interested in the military and learning more about what's going on with them in our community, please take a moment and join us for that. So the free lunch goes to Kimberly Miller. So. Nine 960-6439. 960-6439. So just before I get off of here, I just wanted to say another thanks to Magic City. Jeff, I know you and your team do remarkable things for folks in this part of Wyoming, and hoped all of you watch that video. And it truly is true. Every human being is important. And that's one of our mantras at the Chamber, right, is that we are servant leaders and we work to raise all boats to build a better life for everybody in our community and in our area of the country and ultimately around this whole nation. So Jeff, thank you guys so much for the work you do. It's really remarkable, and we appreciate it very much. At this time, I'd like to welcome your chairman, Kathy Cathcart, back to the stage. I made you sit down and stand up about 20 times. Back to the stage to recognize our speaker.
See how tiny his is? See how big mine is? Then I don't need my glasses. That's the point. All right. Holy cow. I was supposed to thank Barb for introducing all of those new members, and we really appreciate that she does that. Truly want to welcome our new members to the Chamber. I totally understand what it takes to join at this moment in time and how important it is that everybody gets to support the Chamber and the work that the Chamber does for us. So thank you very much. Let's see. Here we go. COVID-19 has affected communities across the globe. However, our businesses have worked together to overcome the most difficult of challenges. While facing new obstacles, many companies have seized opportunities to make a difference, donating goods, services, and proceeds to healthcare workers, COVID-19 relief efforts, and fellow businesses. The challenge is not over, and we must continue to work together for solutions. I am so pleased to welcome our speaker today, Mike Ceballos. He is one of us. Mike has been a member of the Chamber. You start going too fast, that's what you do. Mike has been a member of the Greater Cheyenne Chamber of Commerce for many years. Before entering government service, Mike was a businessman that worked tirelessly for the future of Cheyenne and Wyoming. We need folks like Mike in place of leadership so that the voice of business is heard. I would encourage you to listen closely, ask tough questions, and think about ways we can work together with the state government to keep Wyoming strong in the face of this challenge. Ladies and gentlemen, please join me in welcoming Mike Ceballos, Director of the Department of Health for the Greater State of Wyoming. Great state of Wyoming.
Kathy, I'm going to ask you if everybody can hear me.
Yes, sir, we can.
Okay, that's great. And then I do have Stephanie Pyle with me, so I'll make sure that we get an opportunity to make some connections there. But I thought just to start off a little bit, and thanks for the introduction. I did work for 30 years for the series of companies, the AT&T Bell System, Mountain Bell, US West, Quest Communications was the name when I retired, and was retired for about 7 years, and then was asked to step into this position as the director of the Department of Health for the state of Wyoming. And as you did mention, I was a board member when I first came, and learned so much about the city and the state through the chamber, and was able actually, and I think if Patrick's there, was in leadership Cheyenne with Patrick when we started. So it was just a great way to know about what was going on here and to be able to listen, learn, and grow. I've been with the department now for 2 years, and I would tell you that I'm a generalist. I certainly, my background isn't health, although as a diabetic, health is very important to me. So I've spent it on the other side of the table. But again, it has been another great learning experience for me. One of the blessings that I've had coming into this job is Tom Forsland, who I'm sure you all know was the prior director, and just had done some tremendous work here. We've got a great team. And essentially, there are 4 divisions for a Wyoming Department of Health. One is aging, and again, it's exactly what it says. It's trying to work with our older population and what we can help to do to support them, keep them in their homes, and also to have them living healthy lives. Like, again, I just became Medicare eligible this year, so I want to have many years to use that, and Aging's mission is to do that. We have another department called Healthcare Finance, but it's essentially Medicaid. And again, where the bulk of our budgets lie with the match from the federal government, the 50-50 match at a minimum level, it represents a huge revenue stream. And again, all of the Medicaid functions that we have are worked through that division. We also have a behavioral health division that really works with our mental health city facilities that we have across the state. And between the aging division and the behavioral health division, we also have 5 facilities in the state. Our state hospital in Evanston, the Wyoming Life Resource Center in Lander, and then we have an assisted living facility, the Pioneer Home in Thermopolis, in Basin, our nursing home facility there, and then the veterans facility in Buffalo. And a bulk of our approximately 1,400 employees work in those locations. And again, provide direct care to those folks. For today, what really I was hoping that we could do, and Stephanie Pyle is our division lead for the public health division. That's our 4th division. And Stephanie really does then help manage all of this. And then specifically, what we've been doing with COVID is under her direction. So I'm sure that you've all seen Dr. Harris, who is our state epidemiologist and has really been the bookend when you look at the conversations the governor has had with the press conference he's done. There's those 2 ends, but really Allie works for, Dr. Harris works for Stephanie, and really that's one end of what we're doing with COVID. It's the science, it's what's happening, and it's our mission. It's what we're required, what law requires us to do is to look and protect the health of the public in Wyoming. And so that's really under Stephanie, and that's one end. The other side is the governor. And clearly all of us that work, Stephanie, Dr. Harris, myself, we work for the governor. That's our mission, and our connection then, as you see the discussions that have been going on, is he really sets the policy. So he's the one that certainly keeps us in touch with what's happening in the state, the impacts of all of this on business, on families, and together then that's what we have been working on, is trying to figure out how do we respond to the disease that's out there. What are the things that we can do that we think will have the greatest impact in terms of keeping our population safe? And then certainly from the other side, from the governor's perspective also, is what is it doing to our state, our economics, our certainly the businesses, which I'm here really hopefully to talk about today. And that's the process. We meet regularly with the governor, and certainly we play our role seriously of what we think the health impacts are. But we also know that ultimately it is the governor's responsibility, and so we have to be in line with what he's doing. Just to kind of tell you again, my experience, my background is business, and as I approach this job, sometimes I did wonder, well, what is my role going to be? Because I certainly don't have the skill sets that we have, but this department is just full with really knowledgeable, dedicated people that can very well manage that. And so part of my job is just to make sure that I'm listening to them, understanding what their issues are, supporting them so that we can get our jobs done. And where there's opportunities or problems, trying to see if I can eliminate the roadblocks, which I think is all what you do. Whether you're a business of one or a business of many, that's our role. So what I was hoping to do is I'd like Stephanie to present a little bit, but just to generally tell you, I look forward to the conversation that we're going to have today. I think Stephanie can provide us with a little brief update of what we're doing here, and that will be helpful because she does have the heart of this program with her. One of the biggest challenges that I've been facing is just the misunderstandings that are out there with our current health orders and what we're requiring folks to do, and then what are really recommendations or other issues. And there is great confusion out there. For our orders today, if we want to talk about that, I do want to own the orders. So for instance, the masks that kids are wearing in school, that does come from the Department of Health. But not everything that the schools are doing are ours. So how can we make sure you know what we're doing and then provide the rationale behind the decisions that we've made? Finally, I'm really kind of not here. I don't really want to argue with anybody in terms of saying, we're right, you're wrong. It's just want to share and listen. And I'll just close with every day I try to, and it's just something I've learned from business, is you are our customers, the state citizens are. And so every day I do reach out and try to take to citizens. And I must tell you, as you probably know, we have folks on both sides of this issue with very strong opinions. And what I've been trying to do is listen, explain what our orders are, why we have them, and then listen back to concerns so that at the end of those conversations, I can repeat back to our teams, to the governor, to the teams that are working here, to try to continue to evaluate what our positions will be, what I've heard, why I've heard it, and to the extent possible, folks have provided me with their data for why they have the opinions that they do. So with that, that's really what I'm hoping to do, take as much questions. But Stephanie, if you're there, would you be willing to step in and provide just a little bit of information?
Good afternoon, everyone. Thank you, Mike, for laying that foundation. Can you hear me? Great. Okay. Well, good afternoon, everyone. Thank you for inviting us to join you today. I'm really glad to see and hear the good things that are happening within the chamber. It's nice to be back at a chamber luncheon, though I wish it was under better circumstances. I remember well attending chamber luncheons long ago when I had a business here in Cheyenne and when I ran a nonprofit. As Mike said, I am the Senior Administrator of the Public Health Division. I entered state government in 2011 after running a nonprofit here in Cheyenne that some of you were even involved with. And so I see a lot of familiar faces and names, and it's good to see you all, even if it is virtually. I wish we had good news to share today, but unfortunately we are facing a situation that is worsening by the day. I'd like to start by looking back about 2 months ago. That's when things started to change, and the virus situation in Wyoming has continued to worsen since that point in time. We were not among some of the states who saw earlier issues or more significant issues earlier this year. It seems that we're facing those things at a later time. On September 8th, our 14-day average number of lab-confirmed COVID-19 cases per day was 28. Yesterday, it was about 270. On September 8th, our percentage of tests that were positive over the previous 14 days was running at less than 2%. Now it's running higher than 10%. This is a very important indicator and helps show our cases are not going up just because we're testing more. By September 8th, we'd confirmed 42 coronavirus-related deaths. Now our total is 105. On September 8th, our reported number of current in-state COVID patient hospitalizations was about 18. Yesterday, it was 134. Our ICU units in some hospitals are telling us they are nearing capacity. We're having regular conversations with hospitals around the state so we can keep a close eye on capacity and surge-related issues. We continue to hear mounting concerns about staff shortages in hospitals. To date, we have 12,954 lab confirmed cases and 2,455 probable cases. Fortunately, 9,709 have recovered, but that still leaves us with 5,700 active cases. All of these statistics are alarming and are cause for concern. We continue to make PPE readily available to counties, and we're working hard to notify those who have tested positive about what precautions they need to take. Information is available at our website for those who have tested positive and for those who have been in close contact with someone who has tested positive, so they know what precautions to take. Currently, we're working diligently with the Wyoming Hospital Association to address the surge hospitals are seeing so they can continue to adequately care for Wyoming residents. While it is thankfully true that many people who are infected with COVID-19 are able to quickly recover, anyone can pass it on to someone who is more vulnerable, and no one should think this is just the flu or just a cold. We've been tracking flu-related deaths in exactly the same manner for decades. Our worst season was the 2014-15 flu season with 29 flu-related deaths. We've confirmed more coronavirus-related deaths than that in just the last 2 weeks. With coronavirus, we clearly have a quickly growing problem in Wyoming that stands to get even worse as flu season is upon us and as it starts to get cooler and we're all heading indoors. We know people are tired of this pandemic and all the related issues. And trust me when I say, we are just as tired as you are. We also know that you are worried about your livelihoods. Throughout the pandemic, we've tried hard to take the least restrictive measures possible, and often Wyoming has been among the states with the fewest restrictions. We've heard complaints from both sides. These restrictions are too much, or why don't we have more restrictions? As we've progressed, we made it a point to reach out to stakeholders to determine how we could work together to implement measures to protect public health while still supporting businesses, community functions, and everyday life to the greatest extent possible. I know people have concerns and questions about the various public health orders that are in place. They have been an important strategy for us to help slow the spread of the virus. I would like to point out the importance of remaining familiar with the orders. I've heard time and again that a particular activity or restriction is in place because of the state public health orders. Many of the references are to restrictions that are not actually in our orders and never actually have been. We hear from many people who make assumptions about what is or is not in the orders. In fact, even this week, I have an inquiry about some activities that are taking place at an entity and how the public health orders are inhibiting that activity. And quite frankly, that is not even anything that's mentioned in our orders. So I really do encourage you to read the orders for yourselves if you haven't already done so. And I also want to note that many businesses have implemented more stringent measures than the orders call for, and not everyone realizes that, but it's within a business owner's prerogative to do that. We'd like to ask you to help us respond to these growing concerns. Every action has a reaction, and every action can make our situation in Wyoming better, or it can make it worse. Please follow our common sense measures yourselves and encourage your employees, customers, and colleagues to do the same. Our 3 primary recommendations remain the same. Stay home and away from other people when you are sick, even just a little sick, unless you are seeking medical help. If you have symptoms, don't automatically assume that it's nothing. Plenty of people have done that and unknowingly spread the virus among their families and friends and at their workplaces. We've had countless calls with people who have tested positive that report they worked for a number of days while symptomatic before learning they were positive. Keep 6 feet of physical distance between yourself and others who aren't members of your household whenever possible. Wear cloth face coverings when you're in public settings or around other people who aren't members of your household and when physical distancing is not reasonable or practical. We know masks can help. We're seeing that within classrooms, for example. Wyoming schools are open, and that is an important success story. It's also important to get tested if you have symptoms or have been exposed. We don't want anyone to avoid testing because they don't want to get bad news. When we know we're infected, we can help slow and limit the spread of the virus through isolation and through quarantine of our close contacts. This is a critical strategy to keep things open. With the governor's support, we've worked very hard to expand testing options, and we're in a much better place with testing today than we were when the pandemic first started. Our Wyoming Public Health Lab has done an amazing job. Our traditional 8 to 5 Monday through Friday operation now runs 7 days a week at nearly 24 hours a day. Options with private providers have also expanded. Specifically with the governor's support, we're offering free in-home testing to any Wyoming resident. This test does not require a nasal swab, rather it's a saliva-based test using high-quality lab technology. More information about this test is available on our website. We've been working with some groups such as long-term care facilities for months to support them with what we call surveillance testing. Diagnostic testing is mostly for when you think you might be ill. Surveillance testing is something that you can do regularly to hopefully identify people who may not realize they've been infected. We're offering free saliva-based surveillance testing to Wyoming businesses. If you're interested, we're happy to work with you to support the use of these tests for your employees, including appropriate training. With this employer testing option, employers have the option of allowing employees to complete tests through online telehealth visits or by receiving training on how to self-administer the tests without the need for telehealth visits. More information about the surveillance testing is also available on our website. Our website has a lot of information available about current statistics. We've recently updated our website to include a more interactive feature that allows you to look at county level information, and orders, guidance documents, and many other things are available on our website. We want to work together with you. What is happening to our healthcare system and to our residents is not good for our communities. And what is not good for our communities is not good for our economy. So please help us help Wyoming. We stand ready to help you and the residents of our state, and we ask that you help us gain control over this virus. Thanks to each and every one of you for all you do to make our county a strong and healthy place. And we just, as I said, stand ready to work with you and help you through this pandemic that we're all struggling through. And so with that, I think Mike and I would be happy to take any questions that you may have.
All right, does anybody have any questions they'd like to ask? So I have a question. I'll start it out. I'll ask an ornery one. So we've just put a mask order in Laramie County, right? So one of the things that I did was look up Teton County. So Teton County put a mask order in very early. I printed off both of the statistics from Teton County and Laramie County, and you have a nice graph on there. And we are almost exactly the same. So I guess my question is as you are looking at those kinds of things with those, you know, we didn't have a mask order, they did, our numbers were about the same. Talk about that. And what numbers are you looking at within health other than cases going up to look at these kinds of things?
Sure, thanks for that question, Dale. So, you know, I have not personally looked at Teton's statistics compared to ours recently. One of the things that we need to keep in mind is the difference in populations that we have. So of course, Teton County is a very tourist-based area. And so their mask order did take effect in July. And throughout that time, they've, you know, had an influx of tourists. Fortunately for them, their tourist season was, you know, was still pretty good. Here in Laramie County, we don't necessarily have that same influx of tourists. And so, you know, it will be interesting to see now that the Laramie County mask mandate is in place, what that will look like in terms of the impacts of potentially that helping out our numbers here in Laramie County to go down. Specifically to your question about what measures are we looking at when we're talking about, you know, whether restrictions should be greater restrictions or whether we should lessen those restrictions. We do have some key measures that are up on our website, and sometimes you may have heard the governor and Dr. Harris talking about these things, but we look at new cases. We look at percent of cases attributed to community spread, where we can understand where cases are originating from. We also look at the percent of all tests with a new positive result in the previous 2 weeks, and that's what I mentioned is actually going up. We look at total COVID-19 admissions reported by hospitals. We also look at total hospital bed availability, as well as ICU bed availability. And currently, all of those measures that I just talked about, of those 6 measures, 5 of those are concerning, and only 1 of them is stable at the moment.
And Dale, it's Mike. The other thing that I'd like to add about this discussion is early on, we talked about how can we drive this more local. So what we did with that then is put in this partnership with all of the county health departments that are out there, because we were saying this is restrictions for the state, but possibly there's just things we don't understand because we don't live in those counties. And so we've really developed a partnership, and we'd like counties to come to us. And that's what happened in the case of Teton, is they wanted to do something different because of the tourists. So they implemented that policy. Now that policy then has been used for what is now in Laramie County. But the idea there was really to try to drive it back as close as you can to the local communities and those people that live there. And what's been really great about that is, for instance, with the rodeo, one of the things that we had was the concerns about not having rodeos. But we worked with Cody. They wanted to try to do something. And we said, sounds like a good plan. Let's go ahead and try that. And the great news is what we learned there then influenced our orders. We were able to make some changes because it did look like this could work, and we can do that. So I would say that's the great part, I think, about doing this. I was concerned initially because I was thinking, gosh, are we going to have 23 different versions of everything? And it was hard to manage, but pushing that to more of a local control, I think, has been great. And we have found some activities that we could do that then we made statewide, because it didn't have the danger or the concerns we had. So Dale, now I see also questions coming in. So how do you want to handle this? Because there's a lot of chat questions.
So I think you're welcome to start answering those. Maybe I can read them so our folks here can know what the question is too. So Bob Jensen asks, how do our stats compare to the surrounding states?
Stephanie, do you want to try that?
Sure. So, I think the states in our region are experiencing similar issues right now. We know that North Dakota, South Dakota, Montana, Utah, we know that they're sort of in a similar situation as we are right now. What's even more concerning about that is that as states, we rely on other states if we should reach, if our residents need to be transported to those hospitals. The difficulty when those states are doing as bad, if not worse, as us, is that itself will impact our hospital capacity. So for example, if we have a situation where Utah, they're experiencing a surge, and we have patients or individuals on the western side of the state who might need advanced medical care, they may not be able to be transferred to Utah facilities because of the issues that they're facing. So that's one thing to keep in mind when we're all kind of in the same boat and they're either worse or just as bad as us. That impacts the care that our residents can receive as well.
And the other thing, Dale, that I would add just from my business days, our borders are pretty porous, as you know. And so people do develop relationships. We do here, sometimes folks, and I know in talking with Tim, just like all of our businesses, how do we keep business here? But there are services that go over a border, and it has had an impact. And I think probably, Bob, to your question, I think the only state that probably isn't is less severe than we are right now that borders us is Colorado. Stephanie, is that right?
Yeah, Mike, that sounds right, though I am hearing that in Colorado, things are starting to worsen rather quickly.
So Dale, do you want to keep asking those questions?
Sure. So the next question is, how do you explain the huge, this is from Russell West, how do you explain the huge increase in infections in countries like Germany, Spain, Italy, Austria, and France, to name a few, even though they have very strict mask mandates, and it has a question mark. So what has that approach been? California required masks in June. The cases still went up by more than 300%. And the state remains heavily locked down with higher cases. So I guess, how do all of these activities interact, and what are you seeing from other countries and states?
Thanks for that question. You know, I think one thing to keep in mind is the mask mandate, though it's a political hot topic and debatable, you know, it is one way of helping to control the spread of the virus. So it's not the only thing. We also need to take precautions like staying home when we're sick, keeping that 6 feet of physical distance, wearing masks when we can't otherwise. And, you know, we know that transmission can still occur when people are wearing masks, but we also know that it lessens the transmission and that people can go back to a regular life to the greatest extent possible by taking some of these really important precautions. In some of these other states, there are more members in households potentially, and that can cause further spread of the virus when there are multiple individuals in one household. So there can be many reasons for that. And also when those restrictions are in place, we don't have a way of necessarily knowing how well those restrictions are being followed. So there can be a lot of reasons, and we can't just point to one thing or another. It's really looking at all of these measures as a whole to help protect our communities, to help protect our households, so that we can move forward and try to operate, you know, as normal as we can under the circumstances of living in a pandemic.
You know, and one other thing, we met last week in Riverton with Dr. Burks. One of the things she shared that I think we are trying to learn from each other is what happened in the South is kind of what's happening to us now, because in the South of our country, when it got hot, people went indoors together. And part of the problem with this is there's a great number of people that do that do get COVID that are asymptomatic. They just don't know they've got it. But now all of a sudden, friends that you were comfortable with, or family even that you were comfortable with, come together indoors, and then our rate of positives just jump up. So I think there's a multitude of factors that drive that. But what that happened there then, as she described it in the South, was then the number got so high that rather than the kind of 2-week period that we were traditionally look at, turns into 2 months. So what I think the question is, if they're doing masks, then why did their numbers go up? And doesn't that say masks aren't effective? And what again we're seeing is that all of those conundrums, all of the things that are driving it, do create these bigger outbreaks, and that's where we have to try to stop. And we think masks are part of it. And it's not the only solution, and there's certainly ways that we're not trying to say wear a mask today, but there are folks now, when we have the spread that's this big, that do get it that you don't know have it, and that it does create a bigger problem. So we think, again, it's not the only solution, but it's certainly a good solution.
So I'm going to ask 2 questions here, kind of combined, because I think they are related. Marcos asks, are you anticipating orders for complete remote learning for schools? But Colonel Fred, and man, you should never let Okie read names over the air. Fred Nasruddin asks, based on contact tracing, have you been able to ascertain the most common venue for spread? So as we look back, we do see that since school opened, our numbers have gone up. So what are you finding there, and what do you anticipate moving forward with school?
Well, and let Stephanie kind of bat for me after this. But one thing that I would say, what we really wanted to do, much as we want to with the business, we want businesses to stay open. We understand also the criticality of having schools open. And what we do believe, and the discussions I've had with superintendents are that it is allowing our schools to stay open. And I think, Stephanie, and I'm not positive, but the last time I heard, there have been no buildings that have closed. So not even districts, but buildings that have closed. We think, again, that that's part of saying that it's effective. And what you could say is, well, they're wearing masks, so should there be no cases? And that's not the case. But we do think that the masks are allowing us to keep our schools open, which we think are a critical element of then keeping our business open. Stephanie?
Yeah, thank you, Mike. So I do not anticipate orders for complete remote learning if we're able to keep things as they are in schools right now. We worked very hard back in July, actually June, to develop the Smart Start guidance that we put out for school districts. In response to that, each school district was tasked with putting out their own Smart Start plan as required by the Department of Education. So each school district has options in place for in-person learning, a combination of in-person and remote learning, and then a plan should the school need to close due to positive cases. So currently, that is going well, and there have been cases in schools, but we're not seeing the widespread transmission within schools that we see in other entities. So in that regard, it is very positive. When we're looking at these health-related issues, certainly public health is a concern in relation to the pandemic, but we also understand the whole person and the need for economic health, the need for mental health, and how important it is for our kids to be in school and to have that social interaction and to be able to, just be a kid. And so we are looking at those things, and that was one of the reasons that it was so important for us to work closely with the Department of Education, to really do outreach with school districts, to have frequent contact with superintendents, to answer questions and to help them as they worked on their reopening plans to really be part of that conversation. We also offered testing options for school districts. So they've been involved in that for surveillance testing with both, with two different options that we have available for them. So it's really critical to us to help keep schools open. And we're trying to do everything we can to avoid full remote learning for schools, because we know the hardship that creates for everyone, truly, for parents, for teachers, for students. As a mom of kids who were impacted in the spring, I know that was a very difficult situation for all of us to be in as well. The next question, based on contact tracing, have you been able to ascertain the most common venues for spread? Currently, we are seeing a lot of the informal gatherings where people are coming together and perhaps not taking the precautions that they need to. So we've seen this, of course, with our younger population in terms of, kids in their 20s. We've seen it in settings like, for example, funerals. So we've seen it just really where people are coming together and not taking the precautions that they should. It's a lot of the informal events that might be happening, within our communities that are really causing, it may happen in a small setting there, but then quickly it's within a facility because someone involved in that informal gathering then goes to work. Certainly we're seeing it, as I said, when people are coming to work when they're ill. So it's spread out a lot of places. It's difficult to say it's either one particular place or another. If it were just one place, it would be much easier to contain. But at this point, it's very widespread across our state in a number of different settings.
So I know we're running out of time, but we will answer just a couple more questions. I was handed what I think is a really, really good question, and that is, how are you as a state health department monitoring resource allocation based on other disease pathology, physical and mental? So I think the question is, how are you addressing resource allocation, not only with COVID, but while we're doing that, all of these other diseases are still causing problems, and we are getting, at least by narrative, that some of the mental issues and that kind of thing are actually increasing across the state. So how are you managing that and viewing that?
That is an excellent question. And Mike, I'll take a stab at this, and then if there's anything else you'd like to say. So, one of the things in my division specifically, we don't always work on pandemics. Fortunately, we do a lot of other things as well. So we really do focus on a lot of the issues that you just talked about: mental health issues, suicide prevention. We know that we're seeing higher numbers as a result of many of the struggles that we're having. We were pleased that this year our Suicide Prevention Lifeline was able to get started thanks to funding from the governor and the state legislature. So we do have now an in-state suicide prevention lifeline that is operating. In terms of resource allocation, one thing to keep in mind is that when our hospitals are overwhelmed by COVID-19 patients, it's difficult for people to keep resources or to be able to seek treatment for other medical conditions. And so this really is a critical area where we're looking at, how can we bring in traveling staff to help accommodate those surges within hospitals? Because, when the pandemic started, all of those other issues didn't just go away. And so all of those other issues have essentially been exacerbated by the pandemic. And so we need to gather with our teams that are working on all of those issues all the time to say, how can we strengthen these resources, knowing that everything is being strained as a result of the pandemic? So that is a good question, and we're working within our division and within our agency truly to address those allocation issues that you mentioned.
And Dale, the additional thing I would add is that weekly, the epidemiologists get together, as they always do, and still look at all of those things that you're talking about. And where issues are identified, then again, it comes back to the director's office. And that's again where I think the generalist in me sits down to try to work with our divisions, as Stephanie just mentioned, to say, what can we do about this? What are the impacts from it? Are there care funding dollars that we can use to try to support something? And again, not just trying to run immediately just to say it's a money issue, but practically are there things that we can do that can help address that? And Dale, the one thing I do want to do is, I know there's a bunch of questions. My email is on our website, but it's michael.ceballos@wyoming.gov. I'm glad to take your questions. I'm trying to do that regularly. And even if you'll include a phone number, I try to call back where I can. So if we don't get to them all, I'm glad to get these questions and try to continue to answer it, because I know time's starting to run out.
Is this on? It is. Mike, thank you very much. That's an incredible offer right there, to offer up an email and a phone call back. While the battle continues, know that the chamber is in your corner. Thank you for coming today, and thank you for today's sponsors, Magic City Enterprises and Burns Insurance Agency, and New Vision Federal Credit Union. We hope to see you all in December as we recognize more community heroes during the Women's Leadership Award celebration. Everyone have a great weekend.